Hello and welcome to the Beach House 34 podcast. I'm your host, Christine Worth. Today, we are continuing with the trial coverage of Darlie Routier, a mother who in 1996 was accused and convicted of murdering her two children in Rowlett, Texas. Now, this case has divided public opinion for literally decades, and part of the reason is due to people viewing the evidence in different ways. There have been conflicting stories from those that were involved. There's been stories from the media who would use like sensationalist headlines. They'd cherry pick details. They would show the silly string video at the gravesite whenever possible. And not many people have heard the trial from beginning to end. Cameras were not allowed in the courtroom, and most of what the public heard at the time came from reporters who just happened to be in the courtroom. Now, these transcripts are a story of what really happened in that courtroom and something that not everyone was able to see or hear. In the last episode, we heard from Darren, the final portion of Darren, Darlie's husband, his testimony. And today we move on to Dr. DiMaio. He is a gunshot wound expert and board-certified anatomical, clinical, and forensic pathologist. So if you're just joining us for the first time, welcome. If I had to give you a place to begin, I'd start with the true crime episode about Darlie and her story, which I will link below. If you want to see the exhibits that were shown in trial, and at least the ones that I have access to, be sure to watch and listen on YouTube. And while you're there, like and subscribe to this podcast. It helps so much and doesn't cost you a thing. I will have a link for that in the show notes as well. If you've been with us for some time, thank you so much for coming back and going on this journey with me, because it's been a journey. With all of that said, let's get on to the testimony of Dr. Vincent DiMaio, where we actually first begin with an examination of Dr. DiMaio by the prosecutor, Toby Shook, before the jury has even come into the courtroom. Dr. DiMaio, my name is Toby Shook. I just have a few questions for you for this hearing. What opinions have you come to testify for today? One, that the injuries incurred by Mrs. Routier are those that would be incurred if one was assaulted with a knife, and are not consistent with self-inflicted wounds. She has shown significant blood loss and that her hemoglobin dropped 2 grams. She has evidence of severe blunt trauma to both forearms, more on the right than the left. Let's see. Is that it? Well, I don't know exactly what questions I'm going to be asked, but are those the only opinions? Has one of these attorneys gone over your testimony with you and asked you questions about what you are coming to testify to? Yes, essentially those questions. I think there were some questions asked about bleeding. How much do you bleed with different wounds and that sort of thing, only having to do with, again, with Mrs. Routier. Okay. The first opinion you said was that Mrs. Routier's wounds would have been, did you say consistent with an assailant? What I'm saying is that based on the location and the direction of the wounds and the nature of the wounds, these are the type of wounds that one would get if one was assaulted rather than self-inflicted. They are not consistent with self-inflicted wounds. And what facts or data do you rely on for that opinion? Essentially, the photographs of the wounds and the medical records. All of my opinions are based on photographs of her and her wounds, the medical records, so that's about it. Okay, and then the other was an opinion on blunt trauma to the right arm primarily, and then maybe blood loss. You get various evidence of blood loss. Her hemoglobin went down from 11.6 at about 3:30 in the morning down to 9.6 the following day. Okay, is that, as far as you know, the extent of the opinion that you have come to testify for today? Yes, I think I have covered everything. Let me think a second. And which attorney did you discuss it with? Was it Mr. Mulder? Well, my original conversation was with Mr. Parks, When he was the one who originally retained me, and then I discussed it with Mr. Mulder as well. Okay. The court then says, all right. Mr. Shook says, is that as far as it goes? The court says, any objection? Mr. Mulder says, I think so. That is pretty close. Yeah. Mr. Shook then says, that's all then, Judge. The court says, all right. Any objection? Mr. Mulder says, we have none. The court says, I didn't think so. What about you, Mr. Shook? Mr. Shook says, no, sir. And the court says, all right. Thank you, doctor. Bring the jury in, please. And once the jury has been brought in, the direct examination is done by Mr. Douglas Mulder. You are Dr. Vincent DiMaio? Yes, sir. And will you tell the jury your profession? I am a physician presently employed as the chief medical examiner for Bexar County. You are a medical doctor? Yes, sir. I graduated from medical school in 1965 from the State University of New York Downstate Medical Center. Dr. DiMaio, do you have a specialty in the field of medicine? Yes, sir. I am a specialist in the overall branch of medicine called pathology, which is the study and diagnosis of diseases. Then I have a subspecialty in forensic pathology, which is essentially a branch of medicine concerned with the application of all aspects of medical science, the problems, and the law. Doctor, are you board certified? Yes, I am board certified in anatomical pathology, clinical pathology, and forensic pathology. Does a pathologist also perform autopsies? Yes, sir. And will you give the jury some idea of how many autopsies you have performed? I would say that I've performed somewhere over 7,000 autopsies and supervised maybe about 21,000 in addition. For how many years have you been the chief medical examiner for the county of Bexar? Since March the 1st, 1981. So it will be 16 years come the end of February. And Dr. DiMaio, will you please outline for the jury your education and professional experience for the position that you now hold? Yes, sir. After graduating from medical school and obtaining my MD degree, I spent 4 years additional training in the fields of anatomical pathology and clinical pathology at Duke Hospital in Durham, North Carolina, and the Kings County Downstate Medical Center in New York City. I then spent the 5th year of training in the field of forensic pathology at the office of the Chief Medical Examiner for the state of Maryland. Following this, I took my board exams in 70 and 71 and was certified as a specialist in the 3 fields of anatomical pathology, clinical pathology, and forensic pathology. I then went into the military. I served 2 years in the Army, assigned to the Armed Forces Institute of Pathology in Washington, D.C., where I was chief of the medical legal section for 1 year and chief of the wound ballistics for another year. Then I got out of the service and I moved to Texas. I took the position as a medical examiner in Dallas. I was there from around June the 1st, 72, as I said, March the 1st of 1981. I was the medical examiner there and eventually ended up as the deputy chief medical examiner for Dallas County. That is about it. All right. Now, doctor, there is a magazine or journal in the field of forensics, forensic medicine. Are you familiar with the American Journal of Forensic Medicine and Pathology? Yes. The American Journal of Forensic Medicine and Pathology is the only medical journal devoted to the field of forensic pathology published in the United States. Would you tell us who the editor-in-chief is? I am the editor-in-chief. Okay, how long have you been editor-in-chief? I think this is the 6th year. You have published books in the past, have you not? I have published 3 books. I was the editor of 1 book on forensic pathology. I wrote a book on gunshot wounds, which has been published. And I am also the co-author with my father, who is the chief medical examiner in New York City, on a book called Forensic Pathology, which kind of covers all the other areas of forensic pathology except for gunshot wounds, which I covered in the other book. In addition to your father, you have other pathologists in the family, do you not? Actually, Well, yes, I guess that's right. The older of my three sisters is a pathologist, and my son is a pathologist in Houston, hospital pathology. He is not interested in forensics. You also have a sister who is a pediatrics physician. No, two sisters in pediatrics. Two, excuse me, doctor. In addition to the books, you have published 70 or so articles, have you not? 70 articles, 7 book chapters, and 10 or 11 professional scientific letters. Mr. Mulder then continues. I have marked for identification and record purposes as Defendant's Exhibit 94 your CV, which would acquaint the jurors with your background and qualifications? Yes, sir. All right. Mr. Mulder then continues and says, Your Honor, at this time, I'm going to offer into evidence what has been marked and identified as defendant's exhibits 82, 83, 84, 85, 86, 87, 88, 89, 90, 91, 92, 93, and 95. The court says, Any objection? Mr. Shook says, Wait a minute. What is 93? Mr. Mulder says, 93 was Dr. Santos' report. I think it was already in. I just couldn't find it. Mr. Shook says, No objection. And then the court says, All right, the exhibits are admitted. Mr. Mulder then continues his questioning. Doctor, so that we might identify these exhibits, Defendant's Exhibit 93 is an operative record that was dictated by Dr. Patrick Dillon and also bears the name of Alex Santos? Yes, sir. All right. And you have had that in the past. A copy of that to refer to? Yes, I have. Okay. And then Defendant's Exhibit number 95 is a Polaroid photograph that has been admitted into evidence that is dated 6/6 of 96 at 16:05 hours, which would be, I suspect, military time for 4:05 p.m. of Darlie, Routier. This picture was taken June the 6th of 1996. I'm sorry. Can you see it now? Yes. Okay. Also, you have had occasion to see that, have you not? Yes, I have. All right. And could you come up here so that Richard and John, maybe, so we can show the jury the various photographs that we're talking about? Maybe each could hold 3 or 4. Mr. Mulder then says, Judge, I want them generally to be familiar with the photographs that we have here. The court says, I understand. All right. Maybe we could get in line in order so we don't inundate the jury. Mr. Mosty says, Should I be at the end? The court says, Well, let's put it at the other side. We would never place you at the end. Mr. Mulder says, I said the ones in the hospital are June the 6th. The Polaroid is June the 6th, and the deals where she is standing in clothing other than hospital are June the 10th. Mr. Mulder then continues his questioning. Dr. DiMaio, in reviewing Defendant's Exhibit number 93, that is the operative report. Did you determine from that report that Darlie Routier had experienced considerable blood loss? Yes, sir. That in conjunction with the lab reports, that is, the report by Dr. Santos describes an incised wound running down the right side of the neck onto the chest, and then a continuation on the left side of the chest. And he indicates that he calls it a laceration. It's really an incised wound, a cut, extend down to the sheath of the carotid artery. And this is almost like a thin, transparent membrane. The best way to think of it, it looks like saran wrap. So that was wrapping the vessel, and it is about a millimeter thick. So there may be a little more there. So essentially, you are talking about a cut that went down to virtually the wall of the carotid artery. And if it had severed the carotid artery, she would have bled to death because the blood would have pumped out in a matter of a few minutes and there would have been death. When you look at the rest of the medical records, they indicate that when she came into the hospital, she had a blood hemoglobin. That is kind of a measurement, the amount of hemoglobin that you have in your blood, a blood hemoglobin level of about 11.6, and this is about 3:30 in the morning. Then by the next day, it had dropped 2 points from 11.6 down to 9.6. And what happened is that she had lost a significant amount of blood from this injury, but it's not initially reflected. That is, what happens is that when you lose blood, your body compensates for it by mobilizing fluid from outside the bloodstream and pours it in. In addition, when you go to the hospital, they run those IVs, they are putting in fluids. So what happened is that her hemoglobin appeared relatively normal when she came in because the blood had not been diluted by the fluids. The fluids came in, it dropped. And what it meant was that she had lost a significant amount of blood from these wounds. And in fact, one of the diagnoses was acute post-hemorrhagic anemia, which meant that she lost a lot of blood. So these wounds were not, that and the other wounds on the arm caused a drop of 2 points in her hemoglobin, which is a significant drop. Okay, Dr. DiMaio, what is your evaluation as regards to the seriousness of that neck wound? About another millimeter or two, and she would have been dead. It would have cut right through the carotid artery. In theory, you could put pressure on to stop it, but in a real life situation, people aren't trained like physicians, and she would have bled to death. It's the carotid artery, or the two carotid arteries deliver 75% of the blood going to your head. So she would have lost approximately 40% of the blood supply going to her head. And every time her heart beat, there would have been a pulse of blood shooting out of the neck, 4 or 5 feet, if she had cut the carotid artery. And the cut was, as I said, down to the sheath, a millimeter thick, maybe. And Dr. DiMaio, have you had the opportunity to view the photographs taken of Darlie Routier on June the 6th there in the hospital? Yes, sir. And have you also had occasion to review and evaluate the photographs where she is not in hospital garb, but in regular civilian clothes? Shorts, I believe, the photographs that were taken on June the 10th of 1996? Yes, sir. Okay. Do the bruises on June the 10th of 1996 demonstrate bruising? Yes. I mean, if you look at her arms on the 10th, you can see there is just massive soft tissue hemorrhage. This is her right arm. And what it is going from the wrist right up to past the elbow and into the upper arm. So it's going just sweeping all the way here on what you would call the plexor surface of the arm, not on the back. And this is extensive hemorrhage. And it appears to be a few days old because it's a good purple color, and it's indicative of severe blunt trauma. This, everyone bumps into something, an edge or something, and gets a little bruise. But just think about it. If you have gotten one little bruise, how much force must have been generated, must have been put against this arm to cause the whole arm from the wrist past the elbow to be bruised. So that is a lot of force. And so there is evidence of really severe injury, and there is a very little, what appears to be scrapes here, indicating that there was an impact with something. So you're talking again of severe force. The left arm, again, this is the right. The left arm is not too bad. You can see it's going upward to maybe a third to half a way up the forearm on the surface. And doctor, you have noted that no doubt that there is evidence in the photograph you have in your left hand, or just put down there on it, of a line, an arterial line in her left wrist. Yes, sir. And also an IV in her, I guess, what is that? The inside of the left elbow? Yes, sir. Right. Yes. That's what I call it. All right. That's good enough. All right. At least at the cubital fossa, let's use the crease. Is that bruising in your judgment and experience? Is that the result of medical intervention? No, the bruising here, I mean, at one time, I actually treated live people. I started IVs. That was the day before we had disposable needles, and those needles were dull. I can tell you, I perforated vessels, and there was blood, and you did not get this massive hemorrhage into the arms. And I have had IVs started on me where they have poked through, and you don't get it. This is blunt force injury, and it's deep. It's deep down into the muscle. And so it was deep down, and then gradually the blood percolates up to the surface underneath the skin. Doctor, directing your attention to the right arm, the photographs that depict the right arm, yes, sir, And you will notice two stab wounds in the right forearm. Yes, sir. One of some 2 inches in length and the other of approximately a half inch in length. Yes, sir. Do you have an opinion with respect to whether or not the bruising associated with the right arm was caused by those two stab wounds? No. Stab wounds in those locations would not produce the massive bleeding into the arm. And in fact, if you even use a little, if you think about it, look at where they are. They are on the back, and on the back, there is not much bleeding. Where is all the bleeding? Let's see. Excuse me. There's so many, I've got to juggle these things. It's on the other side. So these stab wounds have nothing to do with the bleeding in the arm. All right, doctor, what sort of instrument caused those injuries? The two penetrating wounds in the no, that caused the bruising. It would have to be something blunt. By blunt, I mean it doesn't have to be sharp. It's not a knife. It's not something with very sharp margins. It could be blows from a fist, because your fist is considered a blunt object. It could be blows from a hard object. People always like baseball bats, things like that. It could be anything that is heavy, that doesn't have any cutting edges, and that could impact hard against the arm. So to cause all the bleeding in this area. Are those injuries consistent and compatible with Darlie Routier having been severely beaten with a blunt, heavy instrument? Yes, that is what they are. These are blunt force injuries impacting something very hard that produced extensive bleeding into her muscle. Are those injuries consistent and compatible? Those shown in the photographs of June the 10th of 1996, are those consistent and compatible? The bruises evidenced in those photographs with having been received by Darlie Routier during the early morning hours of June the 6th of 1996, some 4 days or so earlier. Yes, sir. The coloration is appropriate and it is consistent with it. Okay. Dr. DiMaio, are those injuries consistent or inconsistent with having been self-inflicted? The bruising. And that is, I would say it's inconsistent. I mean, how do you get blunt force injuries here? I mean, it's easy to get blunt force injuries here. If you want, I can bang my arm against the edge here, but to here, and also, again, it's a very wide spread. I mean, this is a lot of force. Everybody has bumped into something and you get a bruise, but look at this. It's just really severe hemorrhage up and down the arm. This is tremendous force. Doctor, what are defensive wounds? Defensive wounds are injuries that you get when you try to ward off an attacker. And the original description had to do with knives, and it could also be blunt force. In other words, if somebody is swinging something hard at you, like a hard object, and you put your arm up like that and you get injuries here and here, then you have what is called defensive wounds because they are incurred when you try to protect yourself. And people will typically protect the most important part of the body. That is the head. So people tend to raise arms up if it's blunt force and try to protect their face and head. And doctor, I'll ask you to refer to the photographs and see if they don't depict an injury to the neck of Darlie Routier, an injury, a stab wound to the left chest of Darlie Routier, cuts to the left inside fingers to 3 of her fingers on her left hand, and 2 stab wounds in her right forearm. Yes, sir. All right. Would you characterize any of those injuries as defensive wounds? The wounds that you would consider defensive wounds would be the wounds on the back of the right forearm. This is a close-up in my right hand. This is the type of wound that if somebody was trying to stab at you with a knife, what do? You put your arm up, and there are 2 stab wounds here and here. If she had been dead and I had done an autopsy, I would have put this section down as 2 penetrating stab wounds of the right forearm, parentheses, defense wounds, because this is the location that you get these wounds in if somebody is going to attack you with a knife. It's typical. That is, people who commit will cut themselves here. Why? Because this is the natural way to do it, although they cut the edge this way. But these are vertically oriented, on the hands in its normal position and on the back. And this is typical for the defense wounds when someone is coming at you with a knife and you hold your arm up in the front of you. And this is where you would get the defense wounds. Okay. And the other place you get defense wounds are on the hands. In fact, the original description of defense wounds is on the hands, because what happens is someone comes at you with a knife, you try to ward them off. A lot of times they try to grab the blade, and you can see there is a cut going across, a very superficial cut going from one finger to the other and there. This has the appearance of one single cut. All right. I know someone says, quote, well, they don't exactly line up. But your fingers, you don't walk around with your hand like that. I mean, you curl them and then maybe down or up. And this has the appearance, again, of a defense wound. Again, if this was an autopsy case, I would put, incised wounds of fingers, parentheses, defense wounds. Okay. And Dr. DiMaio, have you had occasion in the past to examine injuries or render an opinion as regards to whether or not those injuries were self-inflicted? Yes. The last time, I think, was about just before Christmas. A nurse shot her, I think it was common-in-law husband, and her defense was that he attacked her with a knife. And, they were obviously self-inflicted wounds. And my office has had two other, in the last 3 or 4 years, two other cases where the defense was, it was self-defense. And I warded off a knife. And these are defense wounds. These wounds were incurred, but actually they were incised wounds. One was, I think, an oral surgeon, another one, a dentist. And again, I had another case of a doctor who self-inflicted wounds and was trying to say he was attacked. All right, Dr. DiMaio, assume that Darlie Routier is right-handed. Are those injuries that you observed in the photographs, are they consistent or inconsistent with self-infliction? They are inconsistent with self-infliction. Both the wounds, the stab wounds on the back of the right forearm and the stab wounds on the neck. Because if you look at the really incised wounds, when I say incised, I mean a cut. And an incised wound is when, the sharp edge of a knife runs across her body, but a stab wound is the tip going into it. And you can see here, and he demonstrates. Then if we go close up, this is a much better close up. And what this shows is that this wound has started on the right side of her neck here, across the midline, going in a downward path, and then there is a gap, and then there is a second wound. So essentially, if you look at me, there is an incised wound going like this, gap, and then there is another knife wound here. And, if you think, the ruler, think about this. If this is a knife and you're right-handed, I mean, you are going to have to be going like this. The edge of the knife and then skipping a place like that, then changing hands and doing 2 stab wounds here this way. And because, people don't do things the hard way, they do things simple. So this, try and say, you are going to cut like this, and then you have to cut like that, and then stab. It doesn't make any sense for self-inflicted wounds for a right-handed person. And people who are right-handed use their right hand for self-infliction of the wounds because you don't think about it. If I handed any of you this, you would pick it up with your dominant hand. You wouldn't think anything. You wouldn't pick it up with your left hand and manipulate it. It's too difficult. And people don't think about that. They are not going to say, quote, oh, I'm going to switch hands. Now, like I said, the people I saw were doctors and nurses, and they self-inflicted with the right hand, which was their dominant. The wound on the neck is, if I may demonstrate on you, sure. And the witness, the doctor says, may I, Your Honor? The court says, that is quite all right. Mr. Mulder says, that is why I got the ruler. And the witness, the doctor says, as I said, this, and then you have to turn it like this, doesn't make any sense. But that makes sense, or that makes sense, okay? And what happens, you notice how he cringed? Well, let's go in slow motion. The knife comes here and starts to cut. And what will you do? You'll lean back. And of course, when you lean back, there's a gap. but you stick your chest out and you get here. So it's like this. Now lean back. So there is a gap. Stand straight. Mr. Mulder says, okay. The witness says, the cut comes down like that. And now you start to go back. And notice how you get a skip. And if you look at the wounds, they line up. Mr. Mulder then says, would that be the same if I were, could you demonstrate that same thing if I were lying on a sofa? Sure, it's the same thing. Well, it doesn't make everybody horizontal, but it's the same way. If you look at this is one wound coming straight down this way. It's coming from here, gap, space. And this is not consistent with someone self-inflicting it with the right hand. I mean, obviously you can't stab yourself in the back, and people who do self-inflict wounds will always use their dominant hand because that is how you are taught to use knives and things. The court says, thank you, doctor. All right. Dr. DiMaio, are you familiar with blood pattern interpretation? To a certain degree, yes, sir. And Dr. DiMaio, as a medical doctor, what aspects and variables from a medical standpoint must be taken into consideration in blood pattern interpretation? Mr. Toby Shook then says, Judge, excuse me, doctor, could we approach the bench for a moment? And the court says you may. And then at this point, a discussion is held outside of the presence of the jury, and it's not included in the transcript, so we aren't sure what they discussed, but the court eventually says, okay, thank you, go ahead. And Mr. Mulder says, Dr. DiMaio, what are the variables that have to be taken into consideration from a medical doctor's standpoint in blood pattern interpretation? Okay, essentially bleeding is not a simplistic thing. So if you have, some people think, that if you cut yourself or you have a wound, everybody bleeds the same. But there are a lot of things that go into how you bleed. One of the simplest is it has to do with what is called the Langer's lines, the elastic fibers in your skin. We all know as we get older, our skin sags. And what happens is that in the skin, beneath the skin, there are elastic fibers that make the skin very contractile, and they run certain ways through the body. And have you ever seen anyone with a vertical scar on their forehead and you notice how it stands out, but then you see people who have horizontal scars and it gets lost in the normal folds? And plastic surgeons take advantage of these elastic fibers to hide their scars. And so let's say you have been stabbed. Suppose you get stabbed. If you get stabbed perpendicular to Langer's lines, the elastic fibers pull open the wound and you get a lot of blood coming out. If there is a vessel underneath that is spurting, it will spurt out. If you cut along the fibers, the wound tends to be slit-like, and it may not begin bleeding immediately, or if it does bleed, it will not bleed as much as the vertical one. Then you have to take other factors. Right beneath the skin, in most parts of the body, you have muscle. And everybody has had a muscle cramp, when the muscle contracts down. Suppose you get a stab wound in the chest here, through the muscle. Is the stab wound parallel or perpendicular to Langer's lines? And then when it goes in, is it running with the muscle or against it? If it's running against the muscle, the wound will gape open. If it's running with the muscle, it will be slit-like. And when you are irritating the muscle, will it go into a cramp and shut down and reduce the amount of bleeding? Then suppose you do have a stab wound going through here. And then suppose you move your arm, or maybe your arm had already been moved in an unusual position when you had the wound, and now you moved it back, the muscle can slide over and there could be contraction. So a simple stab wound may not be simple. The amount of bleeding may be determined by Langer's lines, the elasticity of the skin, whether you are cutting against the muscle or with the muscle, whether the muscle contracts down. And then when you get into a body cavity, do you hit a large vessel? Does the bleeding from the large vessel go into the cavity first and then leak out? Or is the vessel so close to the surface that it pulsates out? Then, of course, you have clothing. You have, say, a shirt like that. You get a stab wound here, and then the clothing shifts. Or Maybe the clothing had been pulled over when you got the stab wound. Now the clothing shifts over it. And so that affects the way you're bleeding. So the concept people have is you get a wound and the blood comes out in a simple pattern. It's not that simple. There are a number of factors that can determine how much blood comes out, how fast, and whether it comes out in spurts or kind of dribbles out. And unfortunately, some people don't take that into account in bloodstain interpretation. And that is the Achilles heel of bloodstain interpretation. It makes an assumption that is not true, that all wounds are equal, all wounds bleed the same, and that you are starting out with a fixed concept and then you can interpret, and it doesn't always happen that way. On top of that, you will actually get certain areas of the body where you will get a wound. You may not get any bleeding because the initial response to the shock is contraction down of the blood vessels. Even if you have like a major artery, like the carotid artery, if you cut it, suppose you don't cut all the way, you only cut it part of the way, and then someone else gets it cut all the way, which wound is worse? Actually, it's the wound where you only cut part of the way. Because if you cut it completely through, an artery, which is elastic like that, may go into contraction and may actually shut off both ends for a short time before it pulsates. But if you cut it open, you maintain the open lumen of the vessel and the blood keeps pumping out. So the thing is, bleeding and wounds and how the blood comes out is complex and it's not simple. And to try to assume everybody and every wound will bleed the same, it doesn't work out. And again, that is the Achilles heel. So I guess what you were saying is that when somebody gets a stab wound or a puncture wound, the body doesn't always bleed like water runs out of faucet when you turn the faucet on. Right. It depends on, again, all of these factors, including clothing, whether it's with the grain, against the grain, whether it's muscle, whether you hit a vessel. There's a whole bunch of things. And you can only generalize, but it may not actually, what you may say may not apply in this case. But you can just get a general feel. Dr. DiMaio, have you seen many victims of stab wounds? Yes, I would say a couple hundred in the last few years. Let me show you what's been marked for identification and record purposes as State's Exhibit number 25. Yes, sir. And it has quite a number of holes that are taken for evidence purposes. But it also has a hole here, a defect here, it has a defect here, and it has a defect here. I was thinking there were 4 of those defects, but at any rate, here, here, and here. Do you routinely find defects in clothing worn by a victim where there is no corresponding stab wound or cut on the body itself? All the time. How is that? Because essentially what you are talking in most cases is not just somebody sticking a knife in. There is a struggle and you try to grab people, and most stabbings are close combat. Suppose you grab a shirt like this and you pull it, and then the knife blade comes towards you and you pull back so it cuts the material. But let's put it this way. I would say that maybe a quarter of all cases, you will find a little tear, of multiple stab wound cases, a little tear, a point where the tip of the knife has gone through, and even a slash, and on the body, it doesn't correspond. Because what's happened is during the struggle, the clothing has been pulled away, or maybe it just hangs down. And so when someone slashes the knife, it catches the material, but it doesn't go in deep enough to cut the body. So that's just common. All the time you will find defects in the clothing and no injury to the underlying body. An examination of the clothing at the time of the autopsy is part of the autopsy. In my autopsy reports and every one that comes out of my office, if the person is wearing clothing and we have the clothing, in the autopsy report will not only be a description of the body, but will be a description of the clothing and whether there are corresponding defects or non-corresponding defects in that clothing. Mr. Mulder says, "Thank you, doctor. Mr. Shook will have some questions for you." And the cross-examination is begun by Mr. Toby Shook. Dr. DiMaio, it's my understanding that you are the chief medical examiner of San Antonio. Yes, sir. Okay. And additionally, you make extra money coming in and testifying out of other jurisdictions. Right. I am not here in my official capacity as chief medical examiner. I am here on my own time, compensatory time, and this is what I do. It's work on the side. And when you are testifying as an expert, for instance, today, what is your fee that you charge for that? It depends on how far I have to go, and it depends on how long. It depends on how much time. In this particular case, I think my total bill when I submit it is going to be about $1,500. Okay. And you, in recent years, testified for, as I said, the defense in cases such as this, haven't you? Yes, most of my testimony is for the prosecution in Bexar County, obviously, because that is where my job is. And then on private, I do about half the time for the prosecution and half the time for defense. This Friday, I was testifying for the prosecution in Florida, and Tuesday, I am testifying for the defense. A medical examiner is not supposed to be biased one way or the other. Is that right, Dr. DiMaio? That's correct. You get the body in and you do the autopsy and you testify to questions asked about what you found. Is that right? Right. And that is what I'm doing here. I am just testifying to my scientific observations of the wounds in this case. And you have testified for Mr. Mulder before, haven't you? When he was district attorney, yes. And also when he was in private practice. How many times have you testified for him since he has been in private practice, would you say? Maybe 4 or 5 times. Okay. And have you consulted with him on other cases? Well, he's shown me occasionally a case or two, and I have told him things. Did you make any report in regards to this case? No, sir. Any notes in regards to this case? Just this sheet right here, if you want to take a look at it. And then the only other items you looked at were the photographs and the medical records. And the medical records. Yes. Did you look at all of the medical records? What? Well, on my testimony, I also have here some testimony by Dr. Townsend Parchman, but I'm not using any of that. Do you want to take a look? Yes, but you had the Baylor medical records to look at. Is that right? Yes, sir. Okay. And then you had some photographs. When is the first time you looked at these photographs? When I was originally given them it was Mr. Parks. Okay. You have not interviewed anyone else in regards to your testimony or opinions? No, sir. Have not talked to Dr. Santos or Dr. Dillon or any of the nurses at Baylor, have you? No, I have just read his medical records and such. Yes. Okay. And you said that you worked on several cases where people have committed self-inflicted wounds to try to, I guess, cover their tracks or throw off blame on them? Yes, sir. Situations like that? Yes, sir. So do you see that from time to time, don't you? People will go to the trouble of actually having a self-inflicted wound to try to shove blame off on them? Yes, sir. Or point it in another direction? Yes, sir. I guess in your line of work, it never ceases to amaze you with what people can be capable of. Yes, sir. Okay. Now you say that, well, let me start this way. You talk about, excuse me. Yes, sir. Are you through with any material or do you want to look through it? Well, I was going to look at here in a second. Okay, that is fine. Would it be better? No, no, no. Go ahead and look at it. I'll leave it with you in case you need to refer to it. Okay, my piece of paper. And the court then says, can you all hear him okay? And the jurors said yes. And the court says, thank you. All right. Mr. Shook then continues. Now, as far as the seriousness of the defendant's wounds, Dr. DiMaio, wouldn't these surgeons who actually performed the surgery on her be a better judge of how serious those injuries were? Well, yes, sir. And that is why I'm using their description that it went down to the carotid sheath. If you are down to the carotid sheath, you are within 1 or 2 millimeters of the carotid artery. And then, of course, the medical records also, I'm answering you now, all the medical records also show the hemoglobin has dropped by 2 milligrams. So, but would you agree, doctor, that the surgeons who actually performed the surgery would be a better judge as to how serious their injuries or her injuries were? They might be. Yes, sir. Well, they were there, weren't they? Yes, sir. But I don't know But I mean, it's like saying someone shot at me with a 44 Magnum and it missed me, so therefore it wasn't very serious. And doctor, that is not the question I asked you. They were there, weren't they? Right. Yes, sir, they were. Okay. They performed the surgery on her neck, didn't they, Dr. DiMaio? Yes, sir. And I'm basing my opinion on their description of it. They saw the wound opened and operated on it? Yes, sir. So wouldn't they be a better judge of just how serious that injury was? Yes, sir. Okay. Now, as far as your opinion about the defendant self-inflicting these wounds, are you saying that it is impossible that it couldn't have happened? No. What I'm saying is that based upon their location and their path and the nature of the wounds, it is more probable, the term I used, that it's inflicted by someone else. Anything is possible, but I am saying in this case, it's not probable. Okay. And as far as the neck wound you were talking about, well, how would you describe the neck wound? It's a pretty long wound, I guess, wouldn't you say? It looks to be about 3 inches or so, the primary wound. Okay. Have you actually gotten to examine her scar? No. Okay. Would that help you in some of your opinions if you got to look close at the scar? It doesn't make any difference because it is pictured in the photographs. Okay. So those would be fine for you? Yes, sir. Okay. You said, do you have any opinion as to how fast that wound would bleed out? You were talking about when Mr. Mulder was finishing these, what did you call them? Langer's lines? The Langer's lines, yes, sir. Did that make a difference in this case? Or do you have an opinion as to how fast the neck wound might bleed? No, sir. All I know is that, she lost 2 milligrams, 2 grams of hemoglobin. If that neck was cut, or when it was cut, would you expect it to bleed pretty quickly? It would begin bleeding fairly quickly, within 30 seconds to a minute. Yes, sir. Would a neck wound like that bleed a lot, have a lot of blood coming out of it? Under most conditions, it would bleed a lot. Yes, sir. Okay. And how would you describe the position of this wound on the neck? Let's say she didn't survive, she had died. How would you describe it in an autopsy? An incised wound. Okay. And what position would you say it was on the neck? Okay. It would be an incised wound of the anterior aspect of the neck, beginning, I'm just throwing numbers out saying, sure, 2 inches to the right of the midline above, say, an inch or two above the clavicle, the collarbone, and running downward and medially. That is toward the center of the body, crossing the midline and extending toward the medial end. That is the inner end of the left collarbone. And the incised wound extends down through the muscle up to the carotid sheath. Okay. How about the angle? How severe an angle is the neck wound? What do you mean, how severe an angle? Well, is it like vertical, oblique, horizontal? It's an oblique. It's running downward from right to left. As far as the neck wound goes, would you say it was a pretty long wound? Well, I think it's it's a couple of inches, right? I think it says 7.5 centimeters or so. Let me see how long in this drawing. I thought I saw 9 millimeters. 9 centimeters? Or centimeters, I'm not sure. Okay. 9 centimeters then would be approximately 4.5 inches. No, let me see. No, it's 3.5 inches. That is what I said. Okay, it's 2.5 centimeters per inch and 10 centimeters would be 4 inches. Okay, so it's a little less than 4 inches. A little less than 4 inches. Yes, sir. And looking at the photograph here in 28B, it covers most of the front of the neck, I guess, wouldn't you say? It begins to the right of the midline, runs downward onto the upper chest. Right. Yes, sir. So that is the primary one. So we're talking about all down the front of the neck, starting at the top right and going down. Yes, sir. Now you can't say, or maybe you can, if it started here or there. At which end? It starts, the cut. Can you tell us which end? Just looking at it? No. So it could go this way or that way. You could, in theory, say it went up this way. But of course, the problem there is if you are trying to say it was self-inflicted, it becomes even more difficult. Now, doctor, are you saying that the defendant could not take this knife? Oh, I think she could cut her own neck with this knife, couldn't she? Well, I said it's possible, but improbable due to if you look at it, see how it comes down and then skips and then down? Well, that is if you take it through that is one long continuous cut, right? Yes, sir. And it lines up and it's consistent with it. Down. Then you come, as you're coming, then you come back and you put your chest out and then it catches it. Well, I don't want to use this knife on myself. Obviously, let's try to measure it up here. But there is nothing, it would settle the problem, how fast the bleeding was. Yeah, all right. Well, I don't think I will be demonstrating it. Maybe Mr. Mulder could come up here and do that. Mr. Mulder says, hand me the knife, I'll do it. Mr. Shook says, but there is nothing that would prevent her from taking that knife if she wanted to and cutting across here. That's correct. Then she would have to cut again, and then she would have to change hands. Yes, and then turn her arm like that. Yeah. But what I'm saying is it's improbable. It's improbable. Yes, because people who we've seen and who have had incised who try to do that do the same thing. They always use the dominant hand, the right hand. It's so ingrained that you don't even think about it. That is what people usually do. Right. These people are, okay, but there's nothing preventing Mr. Mulder then says, excuse me, if you will just let him answer. The witness says, these people, no insult to the defendant, but they're a little better. They were better educated than her, and they are familiar with medical things, and they may even be familiar with forensics, which I seriously doubt that she is. Mr. Shook then continues, but there would be nothing preventing the defendant from take the knife with the left hand, stabbing it right there in the right arm. She could do that, couldn't she? That's what I said. I said it's possible, but not probable. Well, in fact, there were 2 wounds there on the right arm, aren't there? Right. One is much smaller. Yes. Didn't even require any sutures or anything. This wound we're talking about right here. Yes. And is this wound kind of right here, doctor, would you say in the middle of the forearm or near the elbow? It's approaching the side of the arm. Okay. And this other one is right above it. Right. Okay. It's actually a little further towards the finger. You talk about hesitation wounds. That is when a person might work up enough courage or testing out, for instance. Sometimes they might cut a little bit before they make the big cut. Is that right? Hesitation marks are associated with incised wounds, right? Cuts where they start to make a cut and it hurts, and then they start and it hurts. So you will see a number of smaller wounds. This smaller wound we see here could be consistent with a sort of a hesitation wound, couldn't it? You could say that if you think they are self-inflicted, or if it's not self-inflicted, it's just a small stab wound. Right, it could go either way. But it could be consistent with someone stabbing their arm and then stabbing it with greater force right below it. Right. What I'm talking about is medical probability. I'm not talking about possibility. And again, as far as the angle goes, right-handed, I mean, do you think it's real difficult just to do that? It actually is. Well, I'm doing it, aren't I? Yes, I know. Okay. But, well, okay, never mind. Okay. It's difficult, but then again, okay, so you do it this way, which is difficult. It's easier just to go this way, and most people would go this way. Why go this way? Why do it difficult? First of all, if you're going to cut yourself and you know it's going to hurt and everything, why do it the hard way? Why not just go that way? You are saying that she went that way, then put the knife in her other hand and then stabbed herself. Could do it. Could happen, though. It could happen, but nothing could stop her. And it's not physically impossible to do that. It's not impossible. I said it's not probable. As far as that blunt trauma goes, that is severe blunt trauma, is it not? Yes, sir. And the bruising that you see there, you said, could that be consistent with just being 2 days old? It looks to be a couple of days old. That's all I will say. You can't date it any better. You can't come to dating them real close, can you, doctor? No, sir. If this photograph was taken on the 10th, it's possible that the injury could have happened on the 8th. It's possible. Yes, sir. Okay. This bruise is still, well, somewhat crimson here on this. Yes, sir. Which shows it's more recent bruise. Is that right? Well, I couldn't say that. I mean, I have said that it can, so I wouldn't push my luck. Okay, with the coloration, and black trauma is caused when something strikes the skin very hard. Is that right? Yes, sir. Okay. And you have looked at it could be, like you say, people oftentimes use a bat, right? Yeah. And I just used it because everyone talks about a bat, but it could be anything hard. Does it look like there might be some kind of pattern to these abrasions? The only thing that I saw that suggested a pattern of some sort was those little marks over there, but I'm not going to commit myself. Okay. But this could possibly have a pattern. What you see here, these red, it could be something. Right. Okay. And a pattern can be caused when someone, I don't know, well, you tell the jurors how a pattern can show up on the skin. A pattern indicates that the surface that impacting was not smooth. I mean, there was some irregularity in it. A brick, something like that could leave a pattern. Yes, sir. Anything with a little irregularity in it. Okay. And whatever it strikes on the skin, it might leave an abrasion to the skin or, well, only if you hit it on the side. You have to hit the edge. Okay. And you can see, possibly, you don't know, but possibly that's what we see here on the forearm. Yes, these marks. There's 3 or 4 marks there, and I don't know what they are. They may be abrasions and such, but it's too slim a thing to hang your hat on. I mean, right. Mix up what I'm saying, but let's put it this way. It's there. The significance? I'm not sure. Well, on Defendant's Exhibit 86, do you also see maybe a similar type abrasion? Yes, sir. Okay. And on, I think it's 52E, you have already pointed out this area. Right. But also right along in there, is there also an area? Well, I'm talking about the same thing. All right. All that area. And this bruising obviously goes from here to here. Yes, sir. More on inside. Is that right? Yes, sir. Again, looking at it from the other point of view, if you wanted to self-inflict those wounds, you would just have to take an object and hit the inside of your arm. Is that right? Interesting. It's again with the non-dominant hand. Yes, sir. If you wanted to do it, or you could just take your arm against the wall and whack it real hard, couldn't you? Not, the wall wouldn't work because your hand would hit also. Your hand would hit? Okay. But you could do it if you wanted to. It's possible. It would be very hard. But again, like you said, in your line of work, you see people do all kinds of things. Occasionally, you didn't get any information in the medical records that Mrs. Routier had any blunt force trauma to her torso, did you? No? To her head or face? And that's correct. There's photographs of the face and then part of, well, just her upper extremities, upper chest. Okay. This, getting back to the neck wound again, it's almost 4 inches across and extends across the front of the neck. Is that right? No, it 4 inches long. It begins in the neck and then runs down onto the chest. Okay. Wouldn't you consider that, as far as a neck wound, a pretty long neck wound? 4 inches is fairly long. Yes, sir. Okay. And is it just one? Is it just one wound? The primary one we are talking about on the neck, is that made with one swipe of the knife? The only description says, it says one wound, so that's the only thing. But it's all been sewed up at that point. Okay, well, looking at the photos and what the description is from the medical reports, that's what it shows. It shows it shows a single swipe. Yes, sir. Okay, now you gave an example of, well, usually when you see someone that has been attacked from the front, frontal attack to the neck with, let's say, a knife or sharp instrument. Yes, sir. Those wounds are inflicted. Those wounds inflicted are usually short, are they not? Yes, sir. Okay. Here we have a more long continuous wound. Well, okay. Is that different? By short, okay, if you are talking about incised wounds of the neck, generally they run about the size, which would probably be about 3 or 4 inches, 3 or 4 inches for a neck wound could be called short. I mean, they are not going to be 1 inch wounds, obviously. They are going to be a couple of inches. Well, just a moment ago, you said you would consider it long, did you not? Yeah, it's long. It's not short. But when you ask me about short wounds to the neck, I'm talking 3 or 4 inches too. I mean, I'm talking a long wound to the neck is when somebody gets someone behind you and runs it completely around. So you are talking about 6 or 7 inches. But slash wounds of the neck typically run like this because what happens is they will slash down like this. And so you will see it running about that length. But a long wound would be if you're cutting someone's throat from ear to ear. Now, defensive wounds, you said that you usually see those on the palms of the hand, don't you? No, I said the original description of them is on the palms of the hand, but you will get them on the palms of the hands and on the back of the forearms, even on the back of the other arms. We have had people lying on the ground who have put their legs up and have actually gotten them actually in their legs. All that a defense wound means is that it is a wound incurred in an extremity in an attempt to ward off an attacker. And it's just natural to put your hands up and that kind of thing to block off blows, knife or blunt trauma. Yes, sir. And you will often see, for instance, in a knife attack, wounds to the palms of the hand. Well, the fingers and palms. Yes, sir. And they can be quite deep. They can be deep. Yes, sir. Cut to the bone often, don't they? They can be. Yes, sir. Now, this particular wound to Mrs. Routier's hand, that is not a very deep wound, is it? No, it's a very superficial. There's actually 3 of them, but I think it's probably one swipe. They're very superficial. Extremely superficial? Yes, sir. Okay. Also, how many times on your defensive wounds you see them? What part of the arm do you call this? You talking about plexor surface? I guess so, if that is the word I'm looking for. Yes, you put your arm up, you will see cuts across that way in defensive wounds. Actually, most defensive wounds come from knives are in the back. They are not on this surface. In fact, that's the way you can tell. People come in with scars. People come in with scars on this surface. You think they may have tried this surface, you think they may have been in knife fights. So what's this surface called? That would be the posterior aspect back of the forearm. And what is this surface called? A plexus. Okay, it's this surface, a plexor surface. And you are saying that you don't see defensive wounds on the plexor surface? Well, you can see what I'm saying is you're asking me where they usually occur, and they are classically described as being on the back and not here. These suicidal wounds are described as being on this surface. Homicidal, that is where people attack you on the back. Okay. Usually in cases of homicide, the assailant doesn't leave the weapon at the scene, does he? Yeah, that's correct. Okay. Another area I wanted to ask you, did you look at the autopsy reports on the 2 boys? I just briefly went through them, but since I didn't intend to testify in anything about them, I just had one quick question about that. As far as stab wounds in this case or any other case, the angle, how it goes in the body, let me show you this one. You see this stab wound number 1? Yes, sir. It shows the knife coming across this way into the torso. You can't tell from an autopsy if the person was laying on their back and they were being stabbed at this angle, if they were moving around and maybe the knife went in that way. Is that right? Do you understand what I'm saying? Well, I think so. What you're saying is that just by examining the stab wound alone, you can't say necessarily whether they are standing up or lying down. Is that the question? Right. The answer is yes. And even if they were lying down, they could be moving around during the attack when the knife is going in. Yes, sir. Okay. And as far as blood on the knife, I think that's your understanding that 3 people could have been cut with this knife. Is that right? Yes, sir. Now, if blood on one of the children was not found on this knife, that is not, you can't say, well, then this knife wasn't used to do the killing. Could you? No. Oftentimes, it's only significant if you find blood. It means something. If you don't find it, it doesn't mean anything. When you stab someone in the body, skin might wipe it off. An organ might wipe it off, that kind of thing. Yes, sir. Okay. As far as here, let me give you your notes back. I don't want to forget those. Okay. Thank you. The blunt trauma that the defendant received, you wouldn't expect her to sleep through that, would you? No. Okay. And that is going to hurt when you get hit like that. Yes, sir. And is it a natural reaction? Would you say that that person that is getting hit with blunt trauma, that they are going to yell out? Well, I would assume. Well, I don't know. I have not beaten anybody, so I can't say. I would think it would depend on the person. I mean, what is going on? I mean, okay, nothing. I think that is outside of my area. Nothing would prevent a person from yelling out if they were suddenly attacked in their home and someone started hitting them with a stick, brick, or whatever. I guess not. No, sir. And certainly the defendant, when she is stabbed on the throat, wouldn't sleep through that, would you think? No, sir. I mean, they are going to wake up when someone starts cutting you with a knife. Well, I think she would have to have been moving by virtue, as I said, of going backward, because I think that is a one slice wound. Okay. And if her children were in the same room and stabbed, you wouldn't expect her to sleep through that either, would you? Well, depends. Okay. It depends on how violent the attack was, and it depends on how hard the person sleeps. But under most circumstances, you would think that they wouldn't sleep through it. Well, if you had information that they were a light sleeper and that they had taken amphetamines that day, and the amphetamines are, in fact, are in their blood when they were taken to the hospital, you wouldn't think they would sleep through that, would you? I would say under most circumstances, right. I think phentermine, not amphetamines. Well, what is that? Phentermine is the toxicology report, the only drug present being phentermine, not amphetamines. Phentermine is essentially a weight-reducing drug. Okay. It's certainly not something that would put you to sleep, though, right? No. And if one of your children were about as far as I am to you right now, the one that had all of the stab wounds to the back, Demon, you wouldn't expect her to sleep through that, would you? Again, as I said, under most circumstances, no, sir. Okay. And if on the other child was from about this distance, say about 5 feet, you wouldn't expect her to sleep through that either, would you? Under most circumstances, no, sir. Okay. And did you review the wounds that those children received, Dr. DiMaio? I looked, again, as I say, I looked at them. I didn't pay that much attention. Those were obviously deep, penetrating wounds to the trunk, were they not? Obviously. Yes, sir. Okay. What do you think happened first, the blunt trauma or the cut to the neck? It would be speculation on my part. I can't answer that. Okay. And would you say, Dr. DiMaio, that the wounds that the children received, the deep, penetrating wounds to their trunk areas, are extremely different from the type of incised wound that she received? Well, by definition, a stab wound and an incised wound are different things. And so the incised wound is inflicted from a swipe with a knife, while stab wounds is with the tip end. Yes, sir. You have come across, I think you have in one of your books that I have looked at, you have a section about children that are killed. Homicides? Yes, sir. And you talk about, I think it's in the miscellaneous section, that sometimes children are killed. They are shot or stabbed or things like that. Most children are murdered within the first 2 or 3 years of life, usually within the first 2 years of life or the first year. Okay. And again, well, let me make sure I get the quote right. In talking about these miscellaneous deaths where children are stabbed or clubbed or shot, I believe that you write that, quote, homicides are committed by sane individuals for reasons that may or may not be apparent. There are two groups in this category. First are violent deaths, which, while no attempt is made to conceal the cause of death, the perpetrator will attempt to make the death appear to be an accident or due to another individual. Thus, the perpetrator will relate that a child accidentally drowned in the bathtub or fell in a river. There may be claims that a child was kidnapped by a bearded or masked individual. Yes, sir. So you have seen situations where it's a very violent death to a child, and the perpetrator might say, well, just try to blame it on someone else. Oh, yeah. Okay. I don't know if I caught this right. Did you say people can commit suicide by cutting their own throat, can't they? You have seen that, haven't you? Yes. And when they do that, they do one long continuous cut, don't they? Usually what they do is they will start high up on the side and they will cut down this way and then they will stop about here. Okay. If they are right-handed, if left-handed, they will start and they will come down and it will be cut through. It will start up high below the ear and then cut down this way. It starts up high and then comes down at an angle. Yeah. And then loops across the other side and then all the way across the neck. Yes, sir. Okay. Well, up to a certain point. Usually they only get here because what happens is once you get to this point, it becomes difficult to angle the knife. Thank you, doctor. Mr. Shook says that's all I have. And Mr. Mulder then begins his redirect. Doctor, just a thing or two. Are you familiar with amnesia following a traumatic event? Mr. Shook says, Judge, the court says sustain the objection, 705 hearing. The doctor has testified as to what the basis of his testimony is going to be. Move on to the next question. Mr. Mulder says, yes, sir. Doctor, there is a Polaroid photograph up there that was taken by a member, I believe it's Bedingfield of the Rowlett Police Department. Yes, sir. It has some writing on the back. Yes, sir. Do you see anything in that photograph that is dated, I think, at 16:05 on June the 6th of 96? Do you see anything to indicate bruising of that particular arm? There is a suggestion of some discoloration below this wound over here. Unfortunately, because it's out of focus, it's difficult to say. Okay. It would be somewhat unusual to batter someone in an isolated incident just on the arms, wouldn't it? You mean in defensive? No, just to the bruising here? Mm-hmm. It's likely that this occurred at the same time that these stab wounds were inflicted, is it not? Yes, right, yes. I thought I had said that. Yes, sir. Okay. All I said was I couldn't say whether it occurred immediately before or after. There is no way to say. And they have quite a sensitive test now to determine the presence and absence of blood, even though the instrument has been wiped clean, don't they? Right. You could do a test that would identify the blood. You might not be able to type it, but you could say that there was hemoglobin present or material that tests positive for hemoglobin. One last thing. You have testified before lunch that in your opinion, those bruises are consistent with Mrs. Routier having been beat violently with a blunt instrument on or about both of her arms. It would not be unlikely to also receive an injury to the head during the beating, would it? That's correct. Yes, sir. Mr. Mulder then says, I believe that's all. Thank you. And then there is a recross by Mr. Toby Shook. But you saw nothing in the medical records that showed any blunt force injury to the head, did you? No, not to the face. That also includes the top and back covered by hair, and there is no mention in the records, and of course I can't see it on any photographs. And no indication that anywhere in the medical records that she complained about getting her head whacked real hard. That's correct. Okay. If you are going to get the blunt trauma to the arm, that is going to cause that kind of damage, and you got hit in the head anywhere, it would cause a pretty big knot, wouldn't it? It may. What we're talking about is not a stationary. It's not like you are hitting a stationary object. You would have to say that it's like what's on one arm, that person would be moving trying to avoid it. So it just depends on how hard the impact is. I wouldn't rule it out, but I can't say. Well, if a person got hit on the head as hard as they did on the arm, obviously that is going to cause an injury, is it not? Right. If that was the case, right. But I'm saying I cannot discuss something that I don't know if it was there or not. And say how much force was used to produce a wound, which may or may not be there because you don't have evidence or information that tells you there was any injury like that. And that's correct. Mr. Shook says, okay, that's all we have, Judge. Mr. Mulder says, that's all we have. May he be excused. And so after Dr. DiMaio is off of the stand, the judge continues with your next witness, and Mr. Mulder says, Dr. Lisa Clayton. Court says, all right. And then Mr. Shook says, Judge, could we approach the bench? And at this point, the court has the jury leave the room. And that's where Dr. DiMaio's testimony ends. And we will pick right back up with the testimony of Dr. Lisa Clayton in the next episode. Thank you all so much for listening. You are truly appreciated. If you did like today's episode, please give it a thumbs up or leave a comment on the YouTube podcast page. And don't forget to subscribe as well so you don't miss out on future episodes. And if you want to go ahead and support the podcast, another way to do it is through Buy Me a Coffee. And you'll find the link to that in the show notes below. So again, thank you. I will be back very soon. Bye for now.